Hi, this is Angela with Angela's Nurse Toolbox. Let's talk about the 2026 new recommendations for treating strokes. A stroke is also known as a CVA or cerebral vascular accident. In the United States, this is the fourth leading cause of death and can have serious long-term disabilities. The three types of strokes are: one could be from an aneurysm where a blood vessel ruptures. The next one can be caused by a blood clot in the vessel. The other one can be decreased blood flow due to plaque buildup along the vessel. So with a stroke, think fast. Your symptoms. Look at the face. Is it symmetrical? Have the patient smile. Hands, I want to check them out. Move it so you can see. The hands, have them hold out their hands. If one can move and the other side can't, that might be a signal that the patient is having a stroke. S stands for speech. Are they slurring their speech? Are they able to say words? T stands for time. You need to call 911 if your patient is experiencing any of these symptoms. So when a patient is, think time is brain. If they are suffering a stroke, the new guidelines are from 25 minutes into the arrival of a hospital, the patient should have a screening done, either an MRI, MRA, or a CT scan to confirm the type of stroke. And if it is due to a blood clot in that stroke, an ischemic stroke, we need to make sure we can use the clot-busting medications. They've expanded the time frame up to 4.5 hours from times of symptoms to help treat and get rid of this blood clot. So this would be given through an IV piggyback. And think of Drano. If I have a clogged pipe and I use my Drano, it will help declog that pipe and get rid of that clot. Also, they've expanded the time for an EVT. This stands for endovascular mechanical thrombectomy. So up to 24 hours, they can help prevent long-term damage if it's a large vessel occlusion, to manually go in surgically and remove this blood clot that is occluding that blood vessel in the brain. So I hope this helps your understanding of the new guidelines for 2026. If you like, subscribe to my videos. This is Angela's Nurse Toolbox.